All right, ladies and gentlemen, here's another article that came out in a digital journal. This is an op-ed piece. Inaction on the opioid crisis is killing people and our economy. How many people need to die before we realize federal and state governments have not been doing much to help stem what has become an epidemic that is now affecting our economy, job growth, and legal system. Drug overdose deaths and opioid-related deaths continue to increase in the United States. The majority of drug overdose deaths, more than 6 out of 10, involve an opioid, according to the Center for Disease Control and Prevention, CDC. Statistics now show 91, actually it's 142 people dying every day from opioid overdose, with 64,000 fatal overdose expected this year. The number of deaths is even having an impact on employment and businesses. And a new problem has reared its ugly head in the economic impact the crisis is having on small town finances in many states. Even coroners and medical examiner offices are feeling the effects of the opioid crisis. Federal action has not done much. It has been 6 months since Trump signed an executive order creating a commission to combat the opioid plague. Then on August 10th, he described the plague as a national emergency. Trump has not yet made an official national emergency declaration because such a move would give states access to federal funds to fight it. And that's the thing, he don't want them to have it. And see, personally, I think Trump is going to go completely silent. And that declaration will never be signed. But we'll see. Actually, according to The Intercept, there is no such evidence that Trump administration has moved on nearly any of his drug commission's recommendation. He hasn't. It has gotten so bad around the country that not only are morgues overcrowded, but so are jails and courtrooms. In fact, counties and cities are facing higher costs and emergency call volumes. And we know that's true. But let's add a little bit to those emergency calls. In Indiana County, Pennsylvania, a predominantly rural, mountainous region of the state, autopsy and toxicology costs have nearly doubled in 6 years, from about $89,000 in 2010 to $165,000 in 2016, county data shows. Mike Baker, the county's top government official, says that because of the soaring costs of prosecuting opioid-related crimes and providing the accused with a public defender, the county is using contingency funds to pay for the added costs. Naloxone, the one drug capable of reversing an overdose, has become almost too costly to purchase. Wow. Wow. Adding another problem for emergency responders to cope with. Evzio? Oh, okay, I know what that is. That's the auto-injector of the naloxone. I know what that is. Similar in function to the EpiPen, rose from $690 in 2014 to $4,500. Oh my, woo! Woo! You talk about your price gouging for the Narcan. That is some serious price gouging. 2014, this way, 3 years ago, in 3 years, it went from $690 to $4,500 for Narcan. Oh, man. Woo, he ain't lying. They would go broke. And you got to think about all the doses you got to hit these people with, because they require a lot more if they got fentanyl in their system. Other formulation of naloxone have also seen similar increases in price. Medical examiners feeling the effects of the plague. According to the Vice, the National Association of Medical Examiner mandates that every medical examiner in the roughly 70 accredited offices around the country perform no more than 250 autopsies a year. That's impossible if you have all the drug overdose deaths every single day, 142 a day. But I actually think it's more. I think they're undercutting the number. If a medical examiner's office goes over that number too many times, the office is placed on provisional accreditation until the number goes back down. And this has become a real problem for many medical examiner offices, where the number of autopsies have risen threefold or more over the past 2 years. New Hampshire medical examiners can't completely autopsy every body anymore. It's been getting too many. Wow. Well, I understand that. I'm surprised they're still autopsying these bodies, being that, that a lot of them are drug overdoses. Connecticut's office of the chief medical examiner did lose its full accreditation and was placed on provisional status this year. Chief Medical Examiner James Gill said the opioid crisis had tripled the number of bodies the office sees. We are at increased risk for making mistakes, and that can affect our credibility with families, with jurors, with attorneys, with judges, Gill said. The American economy is suffering because of the opioid crisis. Wow. Didn't they say for years that Black people were dragging down the economy with welfare and all that stuff? You see what liars these people are? Their junkies are the ones dragging down the economy. And that makes sense. It makes sense because there's so many. Just the other day, 23 million people are addicts in America? So it would make sense they would be the drag. You let one of them bring up some food stamps and welfare to me again. Boy, I'm going to really unload this on them. A Goldman Sachs report in July, the opioid crisis was initially fueled by the misuse of prescription opioids, but the spike in overdose deaths in the last 5 years have come from heroin and illicit fentanyl users, most of whom previously used prescription opioids, but switched to these cheaper, more accessible drugs. And recent reports, including one from the Federal Reserve Chair, Janet Yellen, point to prime-age men in particular falling out of the workforce due to addiction with opioids. There are 6 million jobs available in the US right now. Yet, there are also 20 million people in the US addicted to narcotics, including opioids. That is outrageous. You hear that, ladies and gentlemen? 20 million people in America are addicted to opioids. Woo! Y'all come back and talk about some welfare and food stamps again. You just try it. The failures of the federal government are stalling help the states. Okay, let's look at the president's opioid commission first. New Jersey Governor Chris Christie, who chairs the commission, backs Trump commitment to declare an emergency, but Press Secretary Sarah Huckabee Sanders would only call the declaration an involved process. You know what? They're stalling. I'm telling you, he is not signing this declaration because that would take millions and millions of dollars out of their budget, billions actually, billions out of their budget to then provide to all these states because of these junkies. And Trump already said he's not interested in helping people with treatment. If he unleashed this money, he wants the fight to be on the street drugs that are out there, which he ain't gonna win. I can tell you that right now. That's another way of pouring your money down the drain. Okay, let's get back into the article. The commission has a final report due on October 1st, but Christie has already asked for a month extension. In all fairness, the only process made on Trump's opioid policy in the last month has been the announcement of an already existing partnership between the government and the pharmaceutical industry to research and generate non-opioid pain medication and additional medication-assisted treatment options. Things have gotten so bad on September 19th, 51 House Democrats led by Representative Elijah Cummings, Democrat, Maryland, sent a letter to the president urging the administration to declare a national emergency and act on one critical recommendation, ensuring that naloxone, a drug used to reverse the effects of an opioid overdose, gets into the hands of every law enforcement officer in the United States. Wow. Do you remember them making recommendations for them to do this for crack addicts? Oh boy. All right. But looking at all the problems and lack of any solution so far, it seems clear that by not officially declaring the opioid crisis a national emergency, the Trump administration has effectively kept federal monies out of the hands of the state, and he's going to continue to do that. His inaction, coupled with his lack of understanding of the drug crisis, has not only caused a deterioration of our healthcare system, but impact our judiciary system and our economy. So the biggest drag on the American economy, ladies and gentlemen, are your opioid, heroin, and fentanyl addicts out here. They are draining the resources. They are draining the system with all of their 911 phone calls. They're draining all of the money from the states around the country. And they are literally dragging down the entire economy. Tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.